Artificial intelligence developments like ChatGPT have been making major headlines this past year. But did you know smart technology is also making a difference in the medical field? I'm Christine Pei with King 5's Healthlink. Each week, I take a complicated medical story and break it down so you can understand. Today, we're sharing some of the stories from the past year on AI and smart technology, including how chatbots are helping people stop smoking and an app being used to identify different types of coughs.
So this app is a comprehensive program for helping a person quit cigarette smoking.
Dr. Jonathan Bricker is a psychologist and a scientist at Fred Hutch Cancer Center. He and his team developed an app called QuitBot to guide a person through the notoriously difficult task of quitting smoking.
We chose smoking because in the 25 years that I have been a researcher here at the Fred Hutch, what's never changed is that smoking continues to be the most preventable cause of premature death.
In January, the American Lung Association released data showing Washington State received a D grade in providing access to resources to help people quit tobacco. Fred Hutch hopes its app, available nationwide, will help reverse that.
And it does it with a virtual coach, an avatar called Ellen, that people can personalize in how she looks. And she provides this motivational inspiration for people to use.
Ellen is ready to answer any question about cigarettes, the effects of smoking, and more. Bricker said the bot is equipped to answer more than 11,000 questions relating to quitting.
Common questions people ask are, what's in a cigarette? I've been smoking for a really long time. What's going to be different now?
Will people feel silly asking an app these questions?
The really interesting thing happens is that people develop a bond with Ellen, and they know that she is just a computer program, but they're more willing to reveal things about themselves, and they seem very trustworthy of the bot.
Bricker says it's an important component as the tool helps provide accountability in the quitting process. The app is currently free to download in your phone's app store. Scientists at the University of Washington are now using machine learning to identify different coughs from different illnesses, and one day the tool might be available on your smartphone. Tuberculosis, commonly called TB, is a serious bacterial infection of the lungs and can be dangerous if left untreated. It is less common in the U.S., but the World Health Organization says TB kills 1.5 million people each year, calling it the top infectious killer in the world.
Cough is the most common symptom by far in tuberculosis. So 99% of our patients with tuberculosis had a cough.
David Horn is an associate professor of medicine at UW and a doctor at Harborview's TB control program. He and his team are developing an app designed to compare the sounds of TB-related coughs with other kinds of coughs.
Acid reflux, a viral infection, bacterial pneumonia, asthma, etc. Because you need a group to compare them to.
The team of doctors and computer engineers collected data from a group in Nairobi, Kenya for the research. They compiled recordings of coughs from confirmed TB patients to those who didn't have TB. Take a listen. That is the sound of a TB cough, but compare that to this. That is what a non-TB cough sounds like. Notice any difference?
To your question as to whether I can listen and say, aha, that patient has TB, like a TB Pepsi challenge, absolutely not. Absolutely not.
It may not be obvious to the human ear, even a doctor's, but a machine learning algorithm can.
We converted the audio into a frequency domain and looked at the frequency analysis.
Dr. Manuja Sharma is a UW electrical and computer engineering doctoral student. She and her team analyzed more than 33,000 audio clips of coughs collected from study participants at the Kenya Medical Research Institute in Nairobi. Those audio clips, like these, were then fed into a machine learning program trained to analyze their different frequencies, and they found this.
That passive coughs do seem to have signal that can differentiate between TB and non-TB.
Leading to this hypothesis.
Because of that tissue destruction, the cough sound that's produced could be different than what a cough sound is produced in other respiratory health issues.
The findings are promising. Their research, detailed in the paper Science Advances, found their app on an ordinary smartphone mic predicted active TB coughs at a better rate than expensive microphones. And the team realized such technology could be used as a valuable screening tool.
Meaning you would say, aha, this person has a high likelihood of having TB. Let's send specimens for further studies.
The technology could be groundbreaking in communities like Nairobi, where TB rates are high and where the screening process can be costly. Horn and his team think their cough app can be a solution.
What you really need is something that could be used at point of care, meaning at the bedside, that quickly gives you results, that's low cost, that's simple to operate, that doesn't rely on complex infrastructure or even electricity.
The researchers want to further develop this app to eventually record and compare coughs from COVID, pneumonia, and asthma patients. Scientists are still, of course, developing this technology and researching it. It could take several years before we and physicians can even use it as a screening tool. From ChatGPT to AI-generated images, artificial intelligence is in the limelight. But what about using AI as a therapist?
I think I've been working on this for close to 10 years.
Tim Althoff is an associate professor of computer science at the University of Washington. He's developing a set of online tools that use AI as a form of mental health therapy.
I believe that technology is now at a point where it can start to actually be useful to people in a mental health context. And we've especially focused on kind of collaboration between people and AI.
One of Althoff's projects uses AI to help professional human therapists be more empathetic in their interactions with clients.
Essentially what we called empathic rewriting.
Dave Atkins of the Behavioral Research and Technology and Engineering Center at UW-Medicine worked with Althoff on the AI training tool for clinicians.
Training an AI so that when someone is ready to send a message, you could get feedback from the AI on how to edit that message so that it was more empathic.
But one of Althoff's most recent projects is an AI platform that interacts directly with the user to reframe negative thinking.
We co-developed this tool that essentially walks you through a process where you learn how to challenge negative thoughts.
I just call it a self-help tool.
Teresa Wynn of the nonprofit Mental Health America collaborated with Althoff's team to develop the tool.
The idea is that we can change our feelings and we can change our behaviors by first focusing on our thoughts. And so once you start with that negative thought, you learn your patterns of how your thinking causes trouble for you.
How have you designed this so that it emulates a real person, a real therapist?
Yeah. I think one important point is that it actually does not try to do that. And I think that's an important part.
Althoff emphasizes this is an online tool that gives the user suggestions to get away from negative thinking. He says it's not an effort to replace human therapists, but points out,
even if an AI system could replace a therapist, like that therapist most of the time doesn't even exist because that person didn't have access to somebody in the first place.
Wynn adds tools like this can fill a gap for those who lack access or money to receive professional mental health treatment.
So dearly needed, with kind of AI technology being maybe one kind of piece of that puzzle.
It might look like I'm just wearing an ordinary earring, but if you take a closer look, it's actually a smart earring that can measure your body temperature in the same way that even a smartwatch can. Shirley Shui likes earrings.
I wear them like almost every day. I have like maybe more than 20 pairs of earrings.
She also likes the usefulness of her smartwatch.
I use it to like monitor my health status, my heart rate, my activities.
So the UW computer science and engineering doctoral student wondered, what if an earring can do the same thing a smartwatch does, only better?
It's a smart wireless earring that's designed for continuous temperature monitoring.
She calls it a thermal earring. It's about the size of a paperclip and has a 28-day battery life. The gemstone part measures the earlobe temperature. It has a magnet that attaches to the dangly part, which measures the room temperature just inches away from the head.
Because it's so close to your head, the head is part of your core body. So it's actually very accurate and like tightly coupled to your core body temperature.
Joy says the technology is sensitive enough to measure subtle temperature changes from fever, ovulation, even emotional detection.
Temperature is actually a very important vital sign.
The earrings are connected to an app that records the temperature data in real time. While an oral thermometer can capture your temperature at that moment, these earrings record body heat for extended periods of time, which can be useful in monitoring any fluctuations and the effectiveness of certain medication. It's not commercially available yet, but Shui believes her design will catch on, especially now in our COVID world where measuring body temperature temperature can be critical.
We hope like it can serve as a potential platform for like clinical study for fevers.
These pink, plasticky looking things that resemble gummy candy are actually 3D printed tracheas of babies and toddlers. The trachea is the windpipe that connects your voice box to your lungs, and operating on this delicate part of the body can be tricky.
I'm a pediatric otolaryngologist.
Dr. Kaylin Johnson is a pediatric ear, nose, and throat surgeon at Seattle Children's and specializes in airway procedures for kids who have difficulty breathing and swallowing. Among the complex surgeries he does is what's known as a slide tracheoplasty, and training for that surgery is possible thanks to this, a 3D printing machine.
And then actually rehearsed the surgical procedure with a life-size model of the patient with our surgical team.
They're going to basically stitch the airway to the ligament.
Seth Friedman is a scientist at Seattle Children's.
We have a bunch of different inks that are loaded here.
At the hospital's innovation lab, Friedman shows Healthlink an inside look at how such models are made.
And so you can see this purple thing here.
It starts with a CT scan of the child's trachea.
And then we take the set of images, and what we'll first do is we'll first make a model of the inner part, the part that you can't see, the air. And then we have quite a step-by-step process where we can talk to doctors like Dr. Johnson and others to find out exactly how many cartilage rings there are. You can see the little loops and the model that's starting to form.
Then the printer uses those images to create a mold of sorts. The outcome is this, a piece of plastic.
We have all of our great clay tools here to clean out.
Then it's cleaned.
This can be used to remove some of the support material.
Washed several times.
So this is the gel or the material that you'll evacuate.
Then extracted. The replica is then clamped on a makeshift box where surgeons like Dr. Johnson will use it for training before doing the actual surgery on a child's trachea.
We can actually decide how we want to make this cut and transect the airway at the right spot.
Johnson and Friedman say these models provide much needed peace of mind to the patient.
Surgeons really like to practice. So they are sort of more like the concert violinist. And this is a patient that they actually want to practice their craft on.
These tools are now being used overseas. Dr. Johnson and his team have traveled to South America to teach 3D printing models for tracheoplasty. Johnson says it makes sense to practice, particularly for newer surgeon trainees.
So this allows a much more equitable distribution of experience getting prepared for not just the procedure itself, but also patient-specific preparation for surgeries.
Thanks for joining us today. To check out my most recent Healthlink report and get the latest health news, visit king5.com/healthlink.